And you're also serving your customers.
Yeah.
No, but we need to appreciate. Okay, thank you so much.
That is Mr. Masiano.
The famous.
Oh, you have yes, that's him.
I think I called him, was it in January?
Oh.
Okay,
Yes, I did, just to say, no, you do a good job.
And he was nominated for those MDC last
Innovations
year.
Award.
Yes,
Oh,
yes.
okay.
Okay.
So
Thank
that's-
you.
No, we're so proud of you.
Thank you very
Thank
much.
you.
Okay.
Just as a hand washing my cup.
And what is sanitizer? Yeah.
I think it's specific.
I'm only remembering 7th of August because I'm getting vaccines. So that is the date I want.
Just briefly, Honorable Minister of Health, Mrs. Khumbidze Kandodo, Chiponda, MP, Dr. Charles Mansambo, Secretary for Health, Mrs. Nyirenda, Director of HIV and AIDS, and Mrs. Kachale, Director of Reproductive Health, the CEO for TNM, Mr. Arnold Mbwana, Dr. Alida Fembewe, Director of Health and the Social Services, the facility in charge for Area 18 Health Center, invited guests, ladies and gentlemen. We'll spend a few minutes here just to brief the Honorable Minister on our program this morning. Our program is in two parts. First, we'll have a tour by the Honorable Minister of the technologies that the ministry is implementing with support from CDC and PEPFAR. So we'll take the Honorable Minister around. As soon as the Honorable Minister finishes visiting the various points, we'll shift all of us to BICC. So at BICC, we'll have the launch of these activities. Just to say that all of us may not be in person at BICC because we also included a Zoom link in the invitation so that others can follow online due to the COVID challenges that we have. Honorable Minister, allow me quickly to invite the facility in charge to welcome you to Area 18. And after that, I'll invite the country director for EGPAF, who is the implementing partner for CDC and the PEPFAR, to briefly give us information on the technologies that you are visiting this morning. Thank you, Honorable Minister.
Thank you very much, Honorable Minister of Health, welcome our Secretary of Health, Dr. Masambo, who is also my father. He has taught me at the Khumbidze Hospital for a long time. I'm happy about that. Also, I welcome our Director of Health and Social Services, Dr. Rina Fembewe. She's our mother here, and the TNM, also all protocols observed. This is a very brief session here. I just want to welcome you for this, what we are calling electronic medical records. It's a new technology that will help us to really track the flow of our patients, especially those who are dealing with HIV and AIDS, viral load detection, gene expert. It's a new technology that will help us when we are seeing our patients to be able, because the technology is connected to the central lab at Chiso. So it will minimize the time that we spend on the patient. And taking note that we are in a COVID situation, it also improve on the measures that are taken on COVID. We will appreciate this as we move around because in some of the points that you will be able to visit, the patients will just be given a barcode and take the sample to the lab. And at the same time, whatever is extracted from there is also sent to the central laboratory. So it's a new technology that we are embracing this morning, and we hope you will enjoy the tour. Thank you very much, and you're welcome.
Thank you very much, Honorable Minister. So the way PEPFAR and CDC are implementing is that they have implementing partners assisting each facility that they are supporting. And for Area 18 Health Center is the Lighthouse, that is the implementing partner. So we have the executive director for Lighthouse, Mr. Mbewe. I think he will just give us a short briefing, and then I will invite Vina to brief us on the technologies. Thank you.
Honored Minister, Secretary for Health.
Was a microphone meant to be used in case other people?
No.
Okay.
Distinguished guests, ladies and gentlemen, as it has already been alluded to by the Director of Ceremonies, Lighthouse is an implementing partner that is supporting this facility as well as other facilities in the country. So our support, we have actually contributed to the staffing in this facility. We actually have 22 members of staff employed by Lighthouse that are based here. In terms of the breakdown, just to give you an idea, we have one clinic mentor, we have one nurse mentor, we have one data officer, we have 3 HIV diagnostic and retention assistants, we have 5 HIV diagnostic assistants, we have 1 health promoter, and 10 expert clients. These staff that are recruited by Lighthouse are supporting all the services that are provided here, such as the outpatient department, the antenatal services, the family planning, PrEP, the PEP, the HIV testing services, the ART, STI, youth-friendly services, the nurse-led community AIDS program, TB, cervical cancer screening, non-communicable diseases, as well as advanced HIV disease services. Our main goal is to support the ART program. And in terms of the ART on this facility, we have a cumulative cohort of 12,659. But currently we have about 4,615 clients that are well and alive on the ART. In terms of the medical records functions, the facility has an electronic medical record in place, which supports the delivery of antenatal services, OPD, ART, and HTC services. Just a few challenges that we meet with the electronic medical records. Some of the information at some point got missing when we were upgrading, but also sometimes the internet is a bit unstable, and also the system could be slow in sometimes, but also the few EMR machines, we actually need additional machines. But we are working hand in hand with our partner EGPAF to ensure that the challenges that we are meeting are sorted. So in brief, this is the support that Lighthouse as an institution is providing to this facility. Thank you, Honourable Minister.
Thank you very much, Mr. Mbewe. Honourable Minister, SH. Now I will invite Mrs. Vina Sankumpu. I hope I have pronounced that correctly. The country director for EGPAF, who are supporting with the technology implementation at the Area 18 Health Center.
Honorable Khumbidze Kandodo Chiponda, Minister of Health, Dr. Charles Monsambo, Secretary for Health, Ms. Rose Miranda, Director for HIV, Dr. Fani Kachale, Director for Reproductive Health, Dr. Alina Fembiwe, along with DHO, all directors, deputy directors, CEOs, counterparts in media organizations, and my team. Thank you all for being here today. We take this as a high honor and are deeply grateful here. Let me introduce Elizabeth Glaser Pediatric AIDS Foundation. It's a foundation that was born for a mother's determination to find pediatric HIV treatment, and that's what drives us today. And we believe strongly that digital health is equally a tool to end an infectious disease And HIV has been the trailblazer in this country to adopt digital technologies to support the ending of an infectious disease. So similar to Lighthouse Trust, EGPAF supports 9 districts. We are supporting about 290,000 patients on ART across the country. So in addition to the clinical care that we support, we've also been providing support for the digital data system, specifically from 2019 through support from US government, the Centers for Disease Control and the PEPFAR program. So today here we are on Area 18 for you to appreciate how these little investments have supported us in ending HIV, but also the incremental impact is having also on COVID-19 and lab systems, unique IDs and registration systems. So today, as we take you around, we'd like to show you the technologies we've used. It's always evolving. And so it's nice to see the different progress we've been able to make in terms of power in this mission. You will have an opportunity to go to the OPD center where you will see how patients are registered. You'll also see how the help desk, to keep a system at scale, you need a large team that's going to respond to the issues immediately so that people can trust the system and use the system. So you will see a demonstration of the help desk, which through your official launch, we hope to increase the use of, but also the support we provide to the clinics and the district registration offices across the country. In addition, we'll take you to the ART service area where you'll see how patients are registered and how a digital system can support chronic care for patients receiving HIV care, as well as the complicated algorithms that it simplifies for clinicians and nurses to use as they provide that care. You will also see some of the more recent work we've done to integrate the lab order that you can place at ART and immediately have it received at the National Lab Information Management System. So you'll have an opportunity to appreciate the lab and how they're able to capture data from the new diagnostic equipment that the Ministry of Health is investing in, but also transmit the data through connectivity supported by TNM to the FIM National Lab Information Management System. So what you're seeing is the possibility of real-time data, which is what we need to respond to the pandemic that we're all facing right now. What you see here today in Area 18, EGPAF through the US government support is doing in 747 clinics across the country, 13 molecular labs, 28 district labs. We're also supporting the district registration offices. So we're currently supporting the 28 district registration offices with birth and death registration. And through increased use and demand, we hope to link it to all the 747 clinics where you will be able to register birth and death and also transmit this data to make sure patients who go from one clinic to another clinic can be assisted to the best of our ability. So welcome again. We hope this is a snapshot of the impact that we're having at scale through support from the US government. And all of this has been very much made possible by the leadership from the Department of HIV, as well as the Division of Digital Health, that have been active in supporting and planning and helping us execute the work that we do. So thank you, and we are very grateful and honored for your presence here today. Thank you.
Thank you very much, Vina. Honorable Minister, SH, before I invite you to, before I invite the Mrs. Tongi Kaunda, who is going to take us around, to take you, Honorable Minister, around. Let me first recognize the presence of the media, members from the media who are covering our function, both here and at the ICC. At this point, Honorable Minister, let me invite Ms. Tongi Kaunda, who is a nursing officer from Area 18, to explain how we are moving and also to guide you through the tour and the SH. Ms. Tongi.
Dr. Anna Fembewe from Lilongwe DHO, directors and deputy directors from Ministry of Health, Mrs. Rose Miranda, Director of HIV and AIDS and Syphilis Department, distinguished ladies and guests, invited guests, ladies and gentlemen, good morning. On behalf of the management and staff of Area 18 Health Center, I welcome you today to our facility on the launch of implementing the digital health solutions in public health facilities across the country. Area 18 Health Center would like to take the opportunity to highlight the developments and provide on-site tour that will include point of care management system at the outpatient department, ART department, and laboratory departments. With the COVID-19 situation, we are all requested to observe COVID-19 preventive measures. Hence, the tour will be conducted by the Honorable Minister, Principal Secretary, and a few officials, while the rest will watch from the big screen. The facts and figures for Area 18 Health Center are as follows. It has a total catchment population of 220,285. Women of childbearing age, 50,666. Expected pregnancies per year, 11,014. Expected live births, 11,014. Emergency obstetric complications, 1,652. Number of under 5 children, 53,748. The services offered by Area 18 Health Center are maternity, which includes antenatal care, labor and delivery, and postnatal care. Expanded program immunization, outpatient department, ART services where we provide ARVs, HIV testing and counseling services, nutrition, integrated disease surveillance response, mental health, cervical cancer screening, and youth-friendly health services. We thank you, Honorable Minister, for your visit to Area 18 Health Center. It is an honor to us that this event is being launched at our facility. We hope you always remember that this is Capitol Hill Hospital. Thank you very much for your attention.
Yeah. We can get
I'll share with you the tour guide. Apologies, it will be a back and forth process because we want to mimic as much as possible the actual workflows. So here the signings have already been done. Here is so the signing has been done. So we are here. This is the briefing area. From the briefing area, we're going straight to OPD, which we're going to take this way. After OPD, we'll come out from that building using the back way, going to ART, which is here. That's point number 3. That's where the other demonstration is going to be. From there, we'll go back to the main building where the lab demonstration will actually take place, and we'll come back here to actually close the event. So thank you very much. Before I'll just welcome Winston just to demonstrate what you will see on the actual tablets. Thank you, Minister.
Honorable Minister, all distinguished guests, so I'll just take you through how to navigate through the analytics platform that we have on the tablets. So to have them open, just swipe them. They don't have a password. So you'll be greeted with this page, which is our analytics platform that we're using for any visualizations that we have. So here on the left here, the ellipses, this is the navigation menu. And then on the here we have the menu items. So for you to see reports, you just go on see reports. Sorry, I think mine had lost connection. So I'll just go back. So this is the menu. For you to see reports, go on see reports. So there you'll be greeted with a number of reports that you can go through. These are the reports that we'll be seeing as we go around the tour. So if you want to click one report, you can just click on any report that you want to see. Just click on it and then wait for it to load. So the moment it loads, for you to go back and view another report, just again click on the see reports, and then you'll be greeted again with a list of reports. So that's how you navigate through. Okay, thank you.
So at this point, Honorable Minister, I think we'll start the tour. So I think just to guide, as you can see, and as we have said, we have a wide screen here for the rest of the team to be able to follow what is happening as the Honorable Minister and the SH are touring the various technologies. So in terms of moving around, it means we'll have the Honorable Minister, the SH, the Director of Health and the Social Services, the Director of HIV, the Director of Reproductive Health, and the Country Director for EGPAF, and the Executive Director for TNM. So that is the team that will move around. And maybe if there are any people to support the Honorable Minister, maybe they can join, but maybe one or two. Otherwise, we want to keep it a small team, and the rest of us can follow on the big screen. Thank you very much. SH?
the health reports, the monthly, quarterly, and the annually. And in the whole system that is taking place here, the digital system will have the server. That's the yeah, that enables the connectivity of all information nationwide and even with the central lab. My name is Alex Mitchell. I have the secret with MIH. So when a patient is new, we start registering the new. When the patient is not new, in subsequent, we just scan the barcode. For example, I've got this book, so we just scan the barcode like this. So if we scan the barcode, everything is here. We just go with continue. So what we do with this system, when the patient is not new, as we have said, we come to the diagnosis. For example, on this, I'll come to our patient diagnosis. For example, sepsis. So I'll just type sepsis. So all the diagnoses are in here. So if I type sepsis, I'm done. Then I finish up. Then I print out. I print out the visit summary, and they will come out with this paper. When we come out with this paper, we punch in here so that the patient should go down to the pharmacy. Thank you so much.
Wow, that was fast.
When the patient is, that is subsequent. When the patient is not subsequent, it's just new.
Live demonstration.
Yes.
For example, mommy, you don't have it.
Oh, okay.
So I'll start with demographic data. Zina ndiletisha? Nilisha Manyungwa. Manyungwa. Letisha ndio ndo ankaza mimi.
Mazona njema.
Letisha mulidemo. Ndiye kuti tikuyambiranso. Anabadwa chaka chanja mami Letisha 2019. Mwezi wala November 9. Kumudzi kwani kochokera ndikuti Machinga ndo Southern Region. TA1 ndi Chamba. TA alimoso kale. Tingopanga panji. Kuno mukhalira kuti kwakumalamba kwankota. Kankota? Kao. Yeah. Chitukula? Kauma alimoso kale. Pafupi ndi chani kwa kauma? Pafupi ndi nsika skulu, pa skulu pamera ndi pa skulu. It also asks us about phone number, which is not applicable.
Okay.
Don't assume she may have a phone.
Okay.
Private. Oh, I see. Oh, I see.
Yeah.
Okay.
So everything is here. What we need to do is we finish up so that the demographic is safe.
I have a sticker.
You got a sticker now.
Excellent.
Yeah, that's it.
Well done.
Thank you. You don't forget to sanitize.
No, we want.
Just a few additional points. Obviously, the system always has problems.
Yes.
So when it has problems, you just explain a bit on the other side what happens when they report a problem.
Okay.
Yeah. So, Honorable Minister, just to build on what she was presenting,
And as our director has put it, the moment we have an issue, we have the help desk software that the clinic reports to. So for all the data that we collect from complaints raised with regards to the system that we have, we have a dashboard that tracks and reports. These reports are available at facility level, district level, and national level. So on your tablets, just like this is full screen, but you just go on to reports to access the help desk dashboard, which has all the analytics with regards to all the issues that pertaining to the facilities. Then you go to EMR help desk issue dashboard. So this is the dashboard that shows us all the issues currently open at 18 or any other clinic. Currently, yeah. So overall, this is the picture, but we can go, I think, to area 18 just to see. Sorry, this is the clinic. So you can see that we have 30 issues so far closed. We have 0 in progress, and this is just all issues that have been reported. And we have another tab that shows us all open issues at the moment. So as of today, we don't have any open issue for this clinic. And so you can see also the change with pertaining to departments, whether it's OPD, whether it's ANC or ART. So we are able to have different specifications within the analytics. You can also track the closed issues over a period of time, as well as within the different grouping that we have at the facility. Sure.
Excellent.
Sure.
So just to add, the main purpose is that when they report, there should not be a long time, because at some point they just report. So if you see that poster there, they can call, or if the call is not picking, they can SMS. So automatically the ticket is given, and these guys can follow. So if we are pertaining to the SOP which the ministry gave, if the issue is critical and it has taken time, it escalates up to even to the ministry of level, even the DHO might know that, okay, there's an issue which is not being resolved, let's say power or something. So that is just to make sure that if the system really work, not just only as a showcase, but people are using it. If there's a problem, it's been resolved.
Being naughty, blackout. What systems do you have to back up the system?
Yes, just to add Honorable Minister and they said, in this room, we have a backup solution, which is supported. So every facility, there is a full backup for the system, making sure that, so they are a full ecosystem, even the services that are happening here, they are being supported. And then through the network, they are transported. So we make sure that this system, because in Malawi, the grid is not stable. So we make sure that we have even other low facilities, even the solar as a primary, just to support this. They are actually showing an impact rather than just what a white.
If I could just add, maybe this is Dina, also from EGPAF with Charlie. I think one of the key investments is on power backups. That's the main, it is a significant cost as well, because we need to do hybrid power. So it's not just an inverter and battery system, it's also solar. And we've been trying to create these hybrids. So it is a significant investment. And I think one of the things we're trying to advocate is PEPFAR is able to support HIV, but we know there's a large need in ANC, OPD, nutrition. So we hope as the digital health division can scale up these plans, all units could be adequately supported. So I know that's one challenge from our side as well. We put in these power backups, but we know the needs are far more than what we've been able to support. Thank you.
Thank you.
We can move to
Thank you. From here, we'll move to ART department.
Sorry.
Oh, tell us what happened here. Welcome to HRT department, which HIV care is done. This is the reception area outside, and this is the registration room at our department, where we register initial clients who have just been tested HIV positive, and this is test and treat. After the counseling and all things have been done, they come to this room for registration. It's the same as it is done at the all outpatient department, where initial client is needed for registration, collecting the demographic data and everything as it is done at the outpatient department. Well, the subsequent client, you just scan the barcode. And from here, we'll move to consultation rooms. We have consultation room 1 and consultation room 2, where we have a nurse and a clinician. So she may also demonstrate that it is similar as in the outpatient department.
Thank you so much. As she has already said, on this ART department, there are some applications that is the same as there. So we just punch on ART, and then we finish up with activities. So, as he has already said, when the patient is a subsequent, we come with find by number. As you can see, we have 5 rows. Each and every patient got a number. So if it's a subsequent patient, we just go find by number, we print out the number, then we are done with that person. We go for vitals, we are done. But if the patient is not—
What are vitals?
Vital signs, we have checked the blood pressure,
yes. So thank you. For example, if she's an initial, we start again as we did, like the number. For example, give me the name for myself, Avatar. What's that again?
Well, we can use my Khumbidze.
Wow, I'm honored. Khumbidze. That's the first name.
Yes.
Chiponda, the surname. Gender is female. So we come to create a new person with the name Khumbidze Chiponda. So we select the patient, yes. Date of birth.
10/5/69.
1969. May 10. Region of origin.
Central.
Oh, the region. Oh, region. Oh,
Region
said the
of
region.
yeah.
Kasungu. Chilowa Madambe.
TA.
Chilowa Madambe.
And that's why we're saying that you want to
Home village.
Home village Kasungu.
What the district?
District is
Village.
Kasungu.
Okay.
TA Chilowa
Oh,
Madambe.
Chiwengo village. Chiwengo village.
What we're trying to do is to link this up with national registration, because that's some of the information, yeah, and just you protect.
Here in
you
the long way you
password
staying
protect.
currently.
47.
You just password protect and have various levels of it instead of having to give the same message
All
every
the
time.
time.
Yeah, yeah,
Yes.
sure. Yeah. I think it's just a demonstration.
Yeah.
Yeah, we don't have to.
Yeah.
I think we need to do
That's
one.
all.
Otherwise, we'll be here until
That's
we use up the GICC time.
So
Yeah.
after here, you go for presentation. Yeah.
Chabu. No, thank you very much. Thank you.
Yeah. From the registration area, move to the conservation room as a client with your file. You issue the file to the clinician or the nurse who is available. The clinician takes care of everything. Yeah.
Yeah, so my name is Efraim Makwara, I'm a clinician from Lighthouse, and I'm also working as a mentor, taking part in mentoring the providers, make sure we have quality service for our clients in ART. Yeah, so as she has already said, put it out, the first step for our client is the registration where you're coming from. So the registration is done there up to level of the ART number. So as they come in, the first thing we just scan the barcode, and then everything comes on the screen. In case our scanner is not right, we go and find the patient. So for example, this is where we go, and then we go for ART number, which has been given. So I will take the last number that we had, which is 12782, and then you finish. So we give you a page where you need to continue. So it's given patient identification, and then you need to verify with the number. I mean, with the name. After you've entered the number, you need to verify the name if it's correlating. Because otherwise, you can enter the number, which is going to another client who is not currently with you. And then when you verify, you continue, and then it gives you then this is like an HIV section. So in other facilities, it is done in the registration. And then as they come here, you just continue from where they have stopped, and then you continue with the treatment. But because they are sometimes they just do the registration and then you need to continue. So in this case, this is also taken as HIV reception, where you need to ask if that one is the patient or the ascending cardiac. So you select for this, for example, the client that I've said this is a patient because I saw her, I think 2 days ago. And then you click on the guardian to say it's not a client, it's a patient. So after that, you have this, and then you enter the vitals, like the weight. So in this case, let's put 54.0, then you finish. Thereafter, it will give you the lab test. So according to your assessment, you decide which lab test are you taking. So in this case, I'll order CD4 count. So I'll order CD4 count. Then I'll scroll down to get where there's CD4 count.
That's quite a number of tests.
Yeah. Okay. Since we're having a problem, I will just go for TB, microscopic, and then this is sputum. Then you have to choose. Are you doing it as a routine thing? Are you doing it as a targeted? For example, when I'm saying targeted, this client has shown symptoms and you don't to have the results there and then, so we call that targeted. If it is confirmed, TB cases is like when they're taking medication at least 5 months, we need to repeat the test to confirm if the result has gone. Yeah, so in this case, we take it as a routine. And then after taking it as a routine, you need to make an order. So after making an order, it will print out. Yeah, so after
I
that,
don't have many on the missing sign. I hope you don't have many missing, because I've seen a section where you say
no. Yeah, no missing. Yeah. So after we're done with this, we continue with anything that is going to go. So to give you a direction, like to ask if a woman, because if a woman is breastfeeding or is pregnant, if it's a man, to go direct. After you have chosen that is a woman, it also gives you an option where you have to choose which family planning method is the client taking. And then you move on to the next level. So in our case, the woman was not breastfeeding, and then you continue. It will give you the trend of the weight from the start to where it is. So it's also a platform where you have to see if the client is managed for your action. So after the weight, we'll proceed. And for example, I was talking about the family planning method. So the client that I've chosen is a female. So to give you an option to choose which family planning method is the woman taking. So in her case, it was none of the above, meaning she's not taking any kind of medication. It will still keep me ask me if that the day we're giving any kind of family plan. At the same time, it will give me also a reason why is he not taking family planning methods. So there are so many. There are some who are in menopause, they don't need to take family planning methods. There are some, maybe they are young, like adolescents who are not yet in the, who have not yet started the periods. So you can say you choose either it's not sexually active, you choose either the patient is pregnant, it doesn't need family planning methods. Either the patient doesn't need family planning method because she's pregnant, or there are some other medical conditions. For example, there are some women who can come, but they have reacted to all the kind of family planning methods that they are there. So the option is a second. There are some because they can also give an option if none of the family planning methods being taken to say the woman is at risk of pregnancy. So the way the patient was last time, there was no need for family planning method, and the reason was
demonstration. So
yes,
quickly wrap up.
Yeah.
And we move on.
Yeah. So after we have done, and then we have prescribed, but we need we have ordered the test. Then as the patient is going, we take the barcode on the health passport, and then the remaining ones we send it to the lab. So when you go to the lab, they just scan the barcode and then see the test that has supposed to be done. Yeah, so apart from that, we can also order COVID test. We will also do a COVID test. So as previously done, you go straight to the COVID test. Then you enter the username, and then after entering the username, they will give you the option which test are you taking. So you take COVID test, either it is a confirmatory or it's also a routine. So you go that same style, and then which kind of COVID are you doing? Let's say for example SARS-19. Then you click on the SARS-19, and then you do the order. After the order, it also gives you the barcode. Giving the barcode, you take the first barcode of the passport, and then the other one is the patient to the lab. And then when they reach the lab, they also just scan the barcode and they see what is next. That's my system.
And since we trying to use the health diagnostic, the HIV diagnostic assistance to test for COVID, do you intend put the center here? Maybe a director in your end. And that's for the future. I want to see what's in that drawer.
How to do that?
Listen.
Yes.
Honorable Minister, just
other than pediatrics.
Yes,
Honorable Minister, just in a minute, Dr. Maigeta, by the way, there's that dashboard. Just in a minute, just want to understand when after this data is being captured to decision making now nationally. So within a minute, he'll just take you through that.
Yeah, so I think as already put it right. So once we collect data from all the facilities, we have a central place that we keep the data. So from the central place, that's where we pull all the data and then aggregate it. So we are able to present the ERT trends for all the facilities that we support throughout the period from different quarters. So at the moment, as you can see, previous quarter, we managed to report 737 sites. We can also see the trending according to our partners that we work with. And also we can also disaggregate for clients that are already alive and on treatment. We also have other clients that are new. So we can also disaggregate them according to their ages just to get some more insight. I think in brief, that's what I would say, but you can also drill down to a facility or the EMR type, because we have different EMR types, facilities. Some are using POC, some are using EMC, e-Mastercard and point of care. We can also drill down to periods as in how the trend was, or per district. We can try and do that, maybe one district, maybe go to Blantyre. We can also get an insight of how Blantyre is also doing. So these reports are also available for people to access at facility level, national level, as well as district level. So yeah, we try as much as possible to make this information available on time to our stakeholders.
So just to add, yes, exactly.
Please, now related to this one.
Yes.
If very soon we are going to have new guidelines for country. The moment you have new guidelines, then we have to go to the partner to say, can you change ABC variables in the system? So they start working on that, because when we have like new treatment, then it has to, this thing has to be revised.
So if we think beyond HIV, so we bring in malaria, we bring in COVID, bring in all that, how will the system cope?
Through even now.
Yeah, no, so I think this is where we feel like HIV has created a foundation. As long as we can articulate what's needed from the guidelines, from a clinician, from a HDA. So the main thing is for us to have the needs, but there's a development team that will then help develop it. So it's very much possible. And what we're also doing is the modules speak to each other. It doesn't mean you need to throw it. So all of these modules, I think the team, Charlie and the team are working to make sure it's interoperable and integrated. So you always have it seamless. So any new disease that comes up, we will be ready to take it on. So definitely possible.
And also just to comment a bit, when he said this data points, the way you have been taken through, they are actually pushed at end of day to Department of HIV and AIDS. Then at that national level where you have all the 730 something sites, data in the end of the day at a central place, and then they visualize using this dashboard, and they can actually trend that probably the focus should be this district, and they can programmatically look at that. What are the interventions? Are we losing patients, or are we still maintaining patients, or are we adding more patients? So that's the main goal, to make sure that this data actually helps to make those critical decisions. Thank you.
What's the next stop?
The lab.
The lab.
Apologies, you're going to go uphill on that page.
This is not catering for how many patients? Yes, we are in the lab from our ART department where the clinician had made some orders and I as a patient, I was given a barcode. So I'll present to the lab team.
So basically what happens is patients from the ART are brought by attendant. We take the sample ourselves. So when we take this, we could go here. This is where we go to the test button and we search, we scan using So after doing the test, we proceed.
Maybe as he's showing that, I could just speak a little bit what the team does. Usually the equipment needs to be integrated. So that's the machine integration part. And then within the diagnostics, there's a system called the IBLIS. So the IBLIS system will fetch the results. And then we're able to then pull those results into a national. The main thing is giving the data back to the clinician and the patient. So we've also made those systems to feed back into the case-based surveillance, but also to where your clinician could be. And the future is you could also send out SMS results back to the patients directly. So the potential is a lot, but it's a very strong foundation that we're building through these systems.
I think it's okay. I think we've demonstrated enough.
Yeah,
And honorable.
Thank you so much.
Wonderful. Thank you.
We'll go back to
Unless I'm not sure if the team wanted
are they not coming
just
with
in
us?
case. Oh yeah, for BICC, yeah. We'll be there. We'll be there. Okay, check it.
Omatipara so tango jezo bandava. Ndati. Kasipa limau. Okay. Ai tibwera.
Ndizakuimbira koni kanyimbo.
Nanga kumatani desiti dakafika idani. So lero loti ngopanga izizi koma tibwera latu. Ziko mokwambiri. Okay.
Yeah.
ubangani
Thank you so much.
And now, as you see the systems, how they work, we need the network. So he will just explain a bit on the network, the national network we are about to launch today as well.
Yeah, so my name is Joshua. So I elaborate more, for instance, area 18 where if that lab order is made, it needs to be sent to area 3 DHA data center. So we are utilizing TNM infrastructure in a similar way somebody at area 18 can make a call to somebody at DHA. We use the same. Only that goes together by building now a virtual network on top of TNM, and then we protect that network to make sure that the data is secure and secure area 18. So to be sure that we are proactive with the network, we monitor the network 24/7. So all the greens you are seeing like Chisi, Tondoya, Tincheu, those sites are currently up. We can receive data and send the data to those clinics. Where you're seeing the reds means the connection is down. So we are proactively reporting to DNM to say, can you please check this site so that you resolve the issues. So at the clinics, for instance, we go to area 18 where we can pull it here because of the same network. So if there is a power problem, for instance, we ensure that we also have a power backup system to make sure that the system's uptime is improved significantly.
Excellent. So just
you go to Harire or some other distant clinic.
Yeah. So just to, yeah. So just
Chitiba. Let's try Chitiba. This is hospital.
Yeah. So just to emphasize, as we are speaking, 400 facilities are connected.
Excellent.
So from here, you can access 400 facilities across with this network. So the possibility of there, it's enormous.
So somebody the lab tests.
Morning, welcome. My name is Wiza Msugu. I'm the Data Lake team lead, and I'll quickly walk you through the Malawi Health Data Lake. It is also called as the Central Data Repository, as Dr. Charlie has indicated. It is basically a data management system that covers data collection, processing, so that we can be able to discover useful insights, so that can help the ministry to make evidence-based decisions. As my friends indicated from the other systems, we basically integrate with other systems by connecting them to the Central Data Repository through the government-wide area network. We leverage on the connectivity so that we can collect and consolidate the data into a single place. Right now, as far as integrations are concerned, we've managed to connect to 206 point of care facilities. We are in the process of connecting to 520 e-Mastercard facilities. We've also connected to 20 labs, including 7 molecular labs, as well as the death and birth registration system. All this infrastructure, as well as the data, is hosted at the Department of HIV, which is sort of the custodian for the data, as well as the infrastructure that is there. Some of the products that we have from the data lake, medical reports, we've got dashboards, which I'll show you after this slide, as well as we've got a notification system whereby we look at, for example, patients that are defaulting medication. So we are able to identify those patients, send a notification back to the facility so that the clinicians can act on that. For example, they can do contact tracing. Um, the data lake basically, as I said earlier on, the custodian of the data as well as the infrastructure is Department of HIV. I'm sure you're aware that the project is sponsored by CDC through PEPFAR. And then we as EGPAF, we are just implementing the project on behalf of the ministry. This is just an outline or a pictorial view of the workflow. These are EMRs. So EMRs include things like point of care, eMastercard, and then we also have the lab information system, as well as CRVS, which includes death and birth registration. So we leverage on the government-wide area network to push data to the data lake, which is at DHA. And then we have what we call an analytics platform where we can do the data processing. And then the data is consumed by various users, including DHA, clinicians at the facility, dashboards, as well as CDC and other users and stakeholders that are there. Our vision is to have a full-fledged data lake system whereby we should be able to process structured and unstructured data and then provide a platform for advanced analytics whereby we can help with things like predicting patient outcomes so that we can help the clinicians act before a patient, for example, defaults a medication. This is one of the products that we have. It's called continuity and interruption of treatment, whereby we look at 3 indicators. Appointments done. So we look at all the total appointments that were done in that particular quarter. We look at appointments that were overdue, and then we look at appointments that were done. The primary goal is that we try to prevent patients from defaulting medication. So once we identify those that are defaulting, we usually have a notification system, which we send back to that particular facility, which I'll quickly walk you through. So this is an example of an email and a report attachment that is indicating the clients or patients that have been overdue. So for example, the first record is indicating that the patient is overdue by 5 days. And then it is showing the actual facility, which is Zoa Health Center, and all the associated information. So the clinicians are able to track this patient to find out why exactly they are defaulting medication. And then they can act on it. Yeah, pretty much this is what we have. Thank you very much.
Obviously, we need to.
Yes, yes. This email has been sent, and I'm sure action has been done. If we can run the report again, figures will change. Yes.
And also just to clarify, you've heard about eMastercard point of care. Point of care is exactly what you experienced earlier, where you're helping a patient while you're using systems. And eMastercard is made for rural clinics where we don't have infrastructure, so there's just a laptop. And it's done retrospectively, as my friend said there. In end of day, so we still capture that. So whether it's a rural hospital or another hospital, we still have some data.
That's very, very important.
So
So help desk at a national level.
Yes, welcome, Honorable Minister, and all the delegates here. So you've seen all the systems, all the investments, and you heard in Area 18 that they sometimes face challenges. Yeah, so with technology, it's inevitable, but we have a robust system that supports 24/7 all these systems. This is why we wanted you to launch it, so that there's no interruption of services in all these facilities and DROs. So we started with an Excel sheet, but it was very difficult to track the issues and also follow up if the issues have been resolved or not. So we then purchased this help desk system. It's helping us a lot because it's able to track all the assignments that we've done to our officers. Just to explain that we are structured in a way that all the we have HIS officers in all the districts that we are supporting, all the 28 districts. And we also have technicians who are based in the zones, 4 zones. Once the issue has been identified by facility staff, the team is there available to support. But we needed to have a systematic way of recording, processing or resolving the issue, and also closing the issue. And the help desk is also helping us to actually track the tickets that have been outstanding for a long time. We have embedded or included this escalation system, where if the issue has been assigned to me and I'm not resolving it within the specified time, it escalates up to the country director. And sometimes we've escalated issues to the DHA herself because of the nature of the issues. So without wasting much of your time, this is Lillian. She's our help desk officer, and together with Evelyn. One thing I also wanted to mention is that we are supporting the central and the southern region, but we have our counterparts, Look International, who are supporting the northern region, and Evelyn is the help desk officer. I did not mention my name. I'm Frida Gobede. I'm the HIS implementation lead. So Lydian will take over to just show you the workflow and how we are supporting all these investments. Thank you.
Good morning. My name is Lilian Majawa. I'm help desk officer, EGPAF. I'll just take you through the help desk process flow. How we work. We, as Frida said, we work with users. We can deploy so many systems, but if we don't maintain, it's of no use. So that's why we acquired the system to help us efficiently support our users. Yeah, so the flow, as I said, we work with users, so we just want to make sure all the issues are reported to our help desk. So users at the facility can report through the via our toll-free number 2479. It will reach us, or else they can email address. There's an email address here. You can use that, or else you can use the SMS. But the toll-free number is 2479. So when they call us, so all the issues they report to help desk. So if they call us at the help desk, the issue can be resolved at the same, that initial stage, that is level 1, or else it can be escalated. But if we can't resolve, because we can troubleshoot with the users, then the issue is resolved and is closed. But if we can't, then we have to escalate to level 2. Level 2 is our HIS officers. So in all districts, we have HIS officers to support the systems. So we can escalate. We log in the system, then the ticket is produced. So if we produce a ticket, then we need the feedback. We should tell our user the ticket number so that it can be easily followed up. Then if that level, like HIS, goes to the site and it doesn't resolve the issue, it should be escalated again to our zonal technicians now. So it can be a power issue, it can be a network issue. Yeah, so for your information, at level 1, you can either go straight to, because you need to categorize the issue. So you can go straight to level 3 or level 2. So when the our technicians, maybe they don't have the capacity or they need some support, they can escalate that to level 4. So level 4 now is management or something like the, we need the procurement, so we can escalate to level 4. So the most important thing is,
sorry, with time, we just want to maybe to curtail and move to the last part so that we can take.
Before you move on from this, your name earlier. Just, you know, when we had 5% of that was lumped together in 1999. And what to say that would be options within 99 to handle the various. Here there's another number to remember.
2479.
2479. In the emergency, you cannot remember long numbers. So can we not use the same 929 but have those options inside, like the help desk option? Oh yeah, sure. That's what I was saying. Yeah. One number, yeah.
Yes, like if someone needs support, this number is taken here. But moving forward, we will integrate this into the 999.
Yeah, sure.
Okay.
So as soon as I make that call, the number is generated.
Yes, the ticket number.
The ticket number.
As soon, no, you make a call, you talk to me, then I will log in the issue. But I said we have top 3 modes of, no, 4. Because if you use email, automatically the ticket will generate and it will give you feedback that your issue has been logged and this is your ticket to follow up the issue. So whenever you call me, then you use that ticket so that it can easily follow it up. Yeah.
And there was also a question of sometimes the issues can be escalated to our department. Usually sometimes those are issues whereby facilities has not had the units either procured or not installed, therefore affecting the whole system. And we usually now engage with the to say there's this problem, or sometimes they will disconnect based on their challenges, connect to my because of the issues they're having, and then those are the issues in the system.
Okay.
Will not take time. You've already taken time. This is the final decision-making data visualization platform. So we just explain that from all the data which is coming, visually how the decisions decided. So over to you.
Yeah, thank you. Honorable Minister, my name is Winston Mwabumba. I'm a senior informatics officer working for Elizabeth Kreza. So I think as informatics, we are, I would say, an insightful hub where I think our goal, our aim is to promote data use at lowest level to the highest level, at facility level, district level, as well as our stakeholders. So we have different data pipelines that we use to mine our data and transform it so that it's usable to to the end user. So we have different systems, DHIS 2 power apps, the help desk, as well as the other systems that you have gone around, the CRVS limbs. So these are the data sources that we have, that we mine data from. So one data pipeline that we have, we get data from the help desk and the AMR systems. We push them to one central place where we are able to create mining algorithms, which we push into our analytics engine. So from there, we are able to develop different analytic solutions, be able to check the quality of the data just to make sure that it's actually reflecting the trueness of what is on the ground. We also have another data pipeline that we manage, like I said, from the other systems, which, like the other systems, they pull their data to the data lake. So we also mine data from the data lake and import it into analytics framework. So after we do all the modeling and transformation of the data, we push it and make it available to all the stakeholders so that they can utilize it and make insightful or decide how they should move going forward. So I think just to take you through some of the dashboards that we have from the data that we managed to extract. So this one I think we went through, it's a HIV dashboard, which is just showing the trends over time, how the clients are performing. This one is the LIMS dashboard. We are also able to see how many tests have been done on a daily basis. This is where we have statistics for all the labs that we in Malawi. We also have the CRVS dashboard, which is also consolidating all deaths. We're looking at focusing at the cause of death, and in terms of the numbers with relation to age groups, which ones are more, I would say, victims.
another dashboard that we have with regard to another initiative of the data lake, we have the NFT tracker. This one just tracks the daily data collections that we collect from the facilities. So we are able to track how many facilities we managed to collect, how many we failed, and also what the issue was. Another dashboard is also a data monitoring tool just to enhance the quality of the data itself as it's being transitioned from one end to another end. So this one we also went through the help desk where we are also able to follow through all the issues happening reported in the different facilities that we have. I think, as I said, we can also check the closed issues. I think in brief, that's what I would say informatics is responsible within the foundation. Sure.
Good morning, everyone. Our honorable guest of honor, let me welcome you to this important event. Now, before we start, may I have Naomi Msoya for a prayer. Naomi Msoya.
Let us bow down our heads in prayer. Our Heavenly Father, we come before your throne with thanksgiving, honor, praise, and adoration. Father, we thank you because you've granted us the opportunity to see this beautiful day. And we thank you, Lord, that you granted us the grace to gather in this place this morning. Father, indeed, your word says, many are the plans that man makes, but it is you who determines all the steps. Lord, we thank you because, Father, we planned for this day. And indeed, Lord, today you've made it happen. And as we are starting our function this morning, we are asking you, Lord, to take charge. May you be in control, Father, to the glory, honor, and adoration of your name. In Jesus' mighty name, I've prayed. Amen.
Thank you very much for the nice prayer. Our guest of honor, Honorable Khumbidze Kandodo Chiponda, MP, the Secretary for Health, Dr. Charles Mansambo, US government charged affairs, the PEPFAR country director, the CDC country director, chief executive officer, TNM, directors and deputy directors, the Minister of Health, Director of Health and Social Services, Lilongwe, our partners from other government organizations, members of the media, distinguished ladies and gentlemen. Once again, I welcome you to this important event, which has started this morning. Why are we here? Honorable Minister, we're here today because we are launching the digital health investments that have been done with support from CDC and PEPFAR. In addition to that, we've got our friends, TNM. TNM has also done a very good job in supporting these initiatives. In order to prove that, this time around, may I call upon just for a while. Thank you. May I call upon Dr. Lindese Kim, the CDC Acting Country Director, for a presentation on CDC, PEPFAR, and digital health investments.
Good afternoon. Honorable Khumbidze Kandodo Chiponda, Minister of Health, Dr. Charles Monsamba, Secretary for Health, Ms. Rose Nyarenda, Director of HIV and AIDS Department, Dr. Fanny Kachali, Director of Reproductive Health, the directors and deputy directors from the Ministry of Health, Dr. Elenafe Mbewe, the Director of Health and Social Services, Lilongwe, Ms. Veena Sampath-Kumar, Country Director of the Elizabeth Glaser Pediatric AIDS Foundation, Mr. Arnold Buana, CEO of TNM, partners, members of civil society, members of the press, and distinguished ladies and gentlemen. I am deeply honored to join you on this momentous occasion to celebrate Malawi's significant achievements in digital health. Malawi's health information systems are quickly becoming a standard for other African countries and are now recognized globally. I congratulate the Ministry of Health, district health offices, hospital management teams, clinical care teams and providers, health information specialists and partners who have worked tirelessly on this remarkable achievement. Since 2006, the US Centers for Disease Control and Prevention and the President's Emergency Plan for AIDS Relief, or PEPFAR, have been working on digital health solutions. Baobab Health Trust laid the foundation for the Malawi health information systems in the HIV program. In 2019, CDC partnered with the Elizabeth Glaser Pediatric AIDS Foundation, or EGPAF, to ensure digital health is optimized to support HIV patient care while reaching and sustaining epidemic control. We have worked side by side with our MOH Department of HIV and AIDS colleagues and with EGPAF and their partner Luke International to improve the digital health landscape over the last 2 years. Together, we built and deployed sustainable point-of-care electronic medical record systems in over 750 facilities that support patient-level analysis and program reporting for over 850,000 HIV clients. The system allows for faster and more efficient reporting on key indicators for HIV epidemic control. Data reports now run 80% faster, and dashboards have been created so all partners and stakeholders can access their data in real time to support HIV patient care. As of February 2021, over 7,000 reports have been generated using this system. Together, we have supported the National Registration Bureau and the Ministry of Health on the digitalization of civil registration and vital statistics systems, and will expand these to all facilities by the end of the fiscal year. Together, we support capacity building of users to maximize their use of health information systems. And together, we operationalized and implemented a national help desk, including a toll-free number for users to get rapid assistance with technical issues, answering approximately 2,300 tickets in 2 years, and reducing the turnaround time for solutions from an average of 700 hours in January 2021 to just under 4 hours now. Together, we created a data lake or a data repository for HIV data that allows a national program to do advanced analysis for potential machine learning and modeling. And together, we've invested over $7 million to modernize and upgrade equipment and infrastructure for power and local area connectivity, which builds the foundation of digital health. These US government investments have and will continue to improve HIV epidemic control and individual patient outcomes in Malawi. As these systems become interoperable and integrated, the collection of comprehensive patient-level data by the Department of HIV and AIDS will facilitate targeted strategies and solutions to improve a patient's health. We have aligned our investments to support the key elements of the digital health strategy, including the ones I already mentioned, but also improving the security of information and communication systems, promoting interoperability of digital health solutions to enable information sharing for continuity of care, and strengthening the sharing and accessibility of data across systems to enable impactful use. Lastly, I would be remiss to not mention the COVID-19 pandemic. In the midst of these trying last 18 months, EGPAF, in conjunction with the MOH, CDC, and PEPFAR, quickly leveraged the existing information systems to integrate COVID-19 testing to the National Lab Information Management System, or LIMS, to produce a COVID-19 dashboard with real-time data that has been used by key leaders to make important and critical public health decisions. I commend the nimbleness of standing this up. What this pandemic has taught us is that health information systems are vital to the surveillance of emerging pathogens, tracking the number of infections, hospitalizations, and serious outcomes, as well as public health interventions like vaccinations, and the sharing of that important information to the whole country and the global community. The Department of HIV and AIDS has been at the forefront of digital health initiatives, taking lessons learned from this pandemic and investments to scale for the entire healthcare system. Together, we've leveraged site information systems for integrated disease surveillance and improved diagnostic capacity and laboratory information systems, so patient care continues to be of the highest quality and uninterrupted. Before I close, I want to say thank you to the staff that have made it their mission and their passion to provide critical health information services to our fellow citizens. Thank you for your tireless service to your country, especially during this pandemic. Thank you to the Malawian government, the esteemed leadership at the Ministry of Health, and everyone here today. The US government remains committed to the people of Malawi, and we hope that together we can strive for better health for all. Zikomo. Thank you.
Mugabe, who is online, but also the chargé d'affaires from the US Embassy, Mr. Jeremy Tsike, the CDC acting country director, the CEO of TNM, EGPAF country director, the DHO for Lilongwe district, colleagues from the ministry, colleagues from NGOs, and all colleagues that are online. The Department of HIV is a case study of how we have harnessed digital health, particularly use of electronic medical record system to improve quality of care for HIV patients, but also program impact. The department is one of the departments that has registered success. And Honorable Minister, we have almost reached the 95 goals already. I will not say much of that, but very soon we'll come to your office. Why is it that we have managed to register such success? It's because we had real-time data, which would help us make critical decisions. And that's what the investment in digital health can achieve if you invest in digital health. So what we have seen at Area 18 Health Center, probably that's a picture of what it is all about. All those components coming together. Public health, diagnostics, pharmacy, and clinical decision making. We've come from far in terms of electronic medical records. The ministry started earlier, before 2005. For the Department of HIV, we started in 2005, and we opted for the touch screen. The touch screen is the one that you saw being used at Area 18, which is a point of care. And that time we had Baobab Health Trust as a partner. They were contracted to design, deploy, and support. And by then there were 94 ART sites and only about 42,000 patients. CDC came in to pilot at Queen Elizabeth, and after that we have scaled up to more than 750 sites. EGPAF came in 2019 as a partner that has supported us, but also we are celebrating these achievements together because of the areas that have improved so far to date. The rest of the presentation, Honorable Minister, will be brief because you have already seen with your eyes what investment has been has brought the results that I just mentioned. As I mentioned earlier on, and even the teams that were sharing, for EM1 to be deployed, it starts with the programs identifying their priorities, which should be turned into electronic medical record data. So I mentioned to you earlier, Honorable Minister, that like the guidelines that we are going to finalize revising because of the treatment regimens that we have just changed. That information, we pick up the priorities that should be recorded through the medical records and we give it to our partner. And the partner works on the solutions or the application to make modifications, because now we are just continuing from what was already established. And after that, the department together with digital health would look at what the HIS partner has produced. And when we are satisfied, then it is deployed to the facilities. And as it is deployed, we start with a few sites, we pilot, and then we scale up. And the service providers are also trained on how to use the system. So we do together with our colleagues, the partner, digital health section, and the department. And Honorable Minister, it's important that the department is at the forefront because they are the ones that are very familiar with the treatment guidance. And let me mention that we were having challenges in the past. I think it is not an easy path to reach where we are. We would have so many problems being reported in the sites. Sometimes our service providers not able to enter data. But now we are, during this launch, we are celebrating because now there are a lot of improvements. The turnaround time in terms of resolving most of the issues, it's up to 4 hours, unless if they are huge. But within 4 hours, usually the facility would know that the problem they are experiencing would be managed. So I'm just summarizing the successes so far. Now we are in 206 clinics which have point of care system. And largely these are the ones that have many patients, that have a high burden of patients. But we also decided to go to the facilities, and we appreciate that PEPFAR supported this initiative through CDC with the, I would call them lightweight, even though the mechanisms would not say it's lightweight, but it's lightweight. The e-Mastercard in now 521 clinics. We also have 20 clinics that have other systems because we have other partners that also supported. For example, in Neno, there's a system which is supported by partners in health. So those are the ones that comprise the other clinics that we are referring to here. So this is progress. But we are also, as a department, guided by the National Strategic Plan and the HSSSP, we are supposed to expand access to services. So as we expand access to services and more clinics are opened, it means we have to take this investment to those clinics because we are trying to bring services closer to the people. So as I mentioned, we have worked together with our colleagues to train and mentor the users and even supervise them. So what you are seeing on that picture, the yellow is the client card, an ART card, which has quite a number of variables that were being mentioned at the facility. So we have to continuously train them when modifications have been done to the system. This slide is just showing the reports that we generate. We generate 10,200 reports from 750 clinics per quarter. That's a lot, with a lot of variables. So this data, I think, for us to reach a stage whereby we have to use electronic medical records to this extent, it's because there was a demand for age and sex disaggregation. With the improvements we've made in the HIV program, we have reached a stage whereby we should be able to come up with interventions that are focusing on certain populations where we are getting either new infections. So we are able to know which ages are getting new infections, which ages we are having major challenges, for example, with programming, even patient outcomes or patient care. So it is the demand for age and sex disaggregation whereby we had to have these electronic records because manually it's almost impossible. And for now we are happy because we know that we are having a major challenge of the HIV infections, for example, in those that are 19 to around 30s, 35, and usually they are the young people. In terms of viral load suppression, we are having children are the most affected, and of course adolescents as well. So this investment, it can direct in terms of what strategic shifts the program should make. And so far, these are the progress in terms of the patients that we are reporting. This slide, you already saw it. We are working with the districts, and now we are moving towards capacitating the districts and even the facilities to be able to use the data for making decisions. They should be able to know how many patients have, for example, defaulted from a facility, so that expert clients can go out and follow them, or any other community health workers can follow them. So we are having these data reviews. We have them at central level, we have them at zonal level, but we are now also moving towards the districts and even the site themselves, so that the districts can be doing that on their own. And let me mention that we are also complementing with Global Fund resources. This is also another slide which shows how we are bringing in diagnostics to improve patient care, whereby there is now interoperability of the various platforms talking together to make sure that the data is used meaningfully for clinical decision making. And I think our colleague already mentioned that because of the foundation that was laid on the HIV program, now we have brought in the civil registration and vital statistics within the same investment, within the same platforms. Honorable Minister, infrastructure is one major investment area. And the Honorable Minister, this one is ongoing. We have learned as a program that once the EMR was established in 2005, the computers that we're using in 2005 are not the same ones that we are using now. So there has to be continued maintenance and replacement. So apart from the computers, power is an important area, but also even the network and the backup. So what you are seeing are inverters that are backing up power. So power, local area network, and system upgrades in health centers, district hospitals, and even the department itself, because that's where we have this system, Honorable Minister, where that data, the one that we're mentioning, that is the data lake, or it's like a warehouse where we are keeping all that data. The issue of electronic medical records help desk, we never have it. Now we have it, and it has eased the way we manage the problems that our service providers are experiencing in the facilities. So now we have improved system time. I think this was also clearly elaborated. And I mentioned, Honorable Minister, that sometimes clinics may make decision to push power towards, for example, maternity because of other factors. We allow them to do that. But usually when they have that problem, we come in to discuss with the HIS partner, to discuss with the DHO on how we can resolve the problems. These are just the tickets. I think this was already mentioned already. So Digital Health Directorate is also part of all this process, because they are the ones that are that are now mandated policy-wise. Therefore, they are working with us in all these areas, but also together with their staff to support any digital health system. So here is just also showing the investment in network. This was our outcry. I remember the past few years when we met the Parliamentary Health Committee, we would advise them to say, can we have networks in the rural areas? This was one of our pleas. And we are improving, but we still want the parliamentarians to make sure that they push for network in all the areas where we have healthy facilities. Because if we don't have the network, then we have challenges with even transmitting data. But now we are happy that we are working with TNM and also the government-wide area network, which is supporting. The data lake, it holds individual level patient data. And we are talking of so many patients whose data is being pulled into this data lake. It's an ongoing process, and I think at some point we'll have most of the data in the data lake. And this is what they call big data, and big data is not easy to analyze, Honorable Minister. As a ministry, we need capacity to be able to look at this data. We need epidemiologists that are well trained and qualified to be able to interpret this data. But also we need these young guys who also have done data science to support the ministry. So EGPAF does monitor the connectivity in terms of uptime, but also important for backup data, but also supporting automated deployments of updates. And this was already shared on our minister. So in summary, the picture just shows a summary of the major achievements, but also the areas that this investment has focused on: power, network, systems, security, help desk, asset and supply management, but also user capacity. Let me mention that, Honorable Minister, the data lake that we are talking about, where we have a lot of data, very soon also the senior management will be approving a data access and sharing agreement, which we have designed as a ministry because everybody wants this data, either for research or for other uses. So we want to have to manage the data in a way whereby people are going to manage it responsibly. Therefore, they have to sign an agreement if ever they are going to access this data and manage it based on our recommendations. We need continued investment on our minister. HR is the major one. You have seen all these young guys. These young guys are working with EGPAF. We have a few in government. They are difficult to retain, very difficult to retain. We have a few at our department. We also have some from government, but this is an area that we may need to think twice in terms of how we sustain these investments. They are too qualified, well qualified. So probably this is an HR issue that as a ministry we may need to think through. So investment in local HR, particularly the quality and also quantity, is very important as an area for continued investment. Maintenance and replacement of infrastructure, I've already mentioned. Let me mention that we are also trying to complement on Global Fund. Like now we have some resources that we are going to work with EGPAF to maintain some of this infrastructure using Global Fund resources. Improved connectivity, I've already mentioned, but also power. Power is also very important. These are areas that as we move forward, we need to think through, but also retaining the staff, but also capacitating the staff to use all this big data that we are talking about. Generally, for any program to succeed, Honorable Minister, issues of data are important, and investment in digital health is very key. And that's why the program has registered all this success. Having reliable and timely data for decision making is one of the major factors. Thank you, Honorable Minister.
Thank you very much, the Director of HIV in the ministry. Now let us have another presentation or remarks from Mr. Arnold Mbwana, Chief Executive Officer for TNM. Mr. Mbwana.
Our guest of honor, Honorable Khumbidze Kandodo Chiponda, Minister of Health, Dr. Charles Mansambo, our Secretary for Health, Mr. Jeremy from the U.S. Embassy, Ms. Rose Nyirenda, and the fellow directors from the Ministry of Health, Dr. Lindsay Kim, the Acting Country Director for CDC, Let me also recognize the DHO, as well as the country director for EGPAF, directors and other members of staff from the Ministry of Health, as well as the partners that are part and parcel of this huge program. Honorable Minister, let me first say congratulations. I'm speaking as a Malawian. Looking at the tour that we had at Area 18, and we wrapped up with the presentations that have been made this morning, I look to myself and I feel very proud that as a country, this is a huge milestone in as far as not just the health systems, but also development of our nation. I look back to what we've done at Area 18, look back to this, it's huge for our country. And once again, congratulations for this huge milestone that we have achieved today. Honorable Minister, it's an honor for TNM to be part of this achievement. Number one, I like to talk from my heart in respect of the communities that we serve as TNM, but also where we come from as individuals. I'm looking at a rural setup, and there's a clinic there. And the processing of information everything was manual. Today, we have automated that process as government. As TNM, we are very happy and we are honored to have been selected as the partner for connectivity for this huge program for this country. There was a research that was done by McKinsey. In that research, McKinsey says there are 25 categories within the digital health systems. And one of those categories, the critical one, is about the management of records, the electronic management of records, which is what we are doing, or indeed we are launching today. And that talks to the volumes of the investment, but also of how important this project or program is. And McKinsey says the investment in digital health systems can lead to between 10 to 15% reduction in the cost of health. And so yes, we are looking at technology as the enabler, but it's beyond that. It's about the implications on the national budget, the implications of seamless access to the records of our patients across the country. As TNM, our current partnership under this program is to provide connectivity. So we provide what is known as the transport network, where we are connecting sites or locations. Basically, these are health centers, the clinics, the labs that we have talked about, into a central repository. So basically, our job is to provide the connectivity or bandwidth where those records that are being maintained or processed at the rural clinics or health centers should be transmitted over to the central place that we have set. So basically, that is what our job is. And so far under this phase, we have deployed connectivity to about 400 sites or locations. And to me, again, this is a huge, because I know there are areas that are rural areas. Today, they are connected. And I want to thank you once again that you have selected TNM to be the partner for that. And as TNM, Honorable Minister, we are very committed to this program. We know the implications. We know its impact. We know the part that this thing is playing in the development of our nation. And just a few small things that we have also tried to commit to this program. I know we came in as a business, but let me make 2 or 3 things. When you selected us, as TNM, we knew that there's a portion of CSR that we need to do for the people of Malawi. And so we discounted our pricing by 50% to ensure that this program is delivered. It shouldn't be like the normal things that we do as TNM. We know the impact, and so we reduce our pricing by over 50%. Not only that, we have also provided up to 1 gigabyte per second. That's capacity that was provided at Chisu. That capacity has been provided by TNM free of charge. And we are happy and we're committed to do that going forward. Honorable Minister, this morning he also mentioned that, oh, TNM, you need to do more. I know that as part of the program, there's a commitment in terms of the capacity that has been acquired. And I want to commit TNM further by announcing or indeed communicating to you, Honorable Minister, that as TNM, we know that the traffic or data that is being processed from a rural trading center cannot be the same as the one that is being processed from Kamu Central Hospital, for example. These are different facilities. And so as TNM, we are committing to upgrade. I know we committed in the contract, but today we commit to upgrade the bandwidth or capacity that we have provided for the 4 central hospitals. We will double it at free of charge to you. The director has mentioned the issue of connectivity. We have taken note of the issue, we understand, and we commit to improve. We are working tirelessly. We know that this milestone, you see, when something is good, and there's 1% that is not so good, people would pick at that 1% and say, no, this government, oh, this person, oh, this company. So we fully understand, and as TNM, we commit that we will not let you down. For the areas, the locations, and the sites that we have actually deployed or continue to deploy, we ensure that we will not let you down by ensuring that the network connectivity is seamless, is available, and you are able to do everything that you are set to do under this program. So we are committed to this partnership. Just an additional mention of TNM. We have launched what is known as TNM Muzwatu. I'm looking at the vision of the things that are being done under this program. And as TNM, if you look at TNM Muzwatu, for example, it's also a partnership model. We were going to use the facility that we have under Muzwatu, where we need to work together even more. We as TNM, we commit ourselves to work together with the government, with the Ministry of Health. We are available at any point you want us to come in and support these initiatives. Let us know, and we'll be glad and happy to support the government initiatives. Once again, Honorable Minister, thank you so much and congratulations.
Our guest of honor, thank you very much, Mr. Arnold Mbwana, for the nice and good remarks. Now, our next presentation is on commitment to support Ministry of Health from the government of USA. This is where Mr. Jeremy. Thank you.
Mwazuka Bwanje. Honorable Khumbidze Kandodo, Chiponda Minister of Health, recognizing Dr. Charles Mwansambo, Secretary of Health, Ms. Rose Nyirenda, Director of HIV and AIDS Department of the Ministry of Health, Dr. Fanny Kachela, Director of Reproductive Health, the directors and deputy directors from the Ministry of Health, Dr. Alanafe Mbewe, the Director of Health and Social Services in the Longway, the Country Director of the Elizabeth Glaser Pediatric AIDS Foundation, Mr. Arnold Mbwana, TNM CNO, our partners, members of civil society, members of the press, and distinguished ladies and gentlemen. I am honored to be here with you today to celebrate the launch of these PEPFAR-supported digital health investments. Collaborating with the Ministry of Health and our implementing partners, this CDC-led initiative highlights the strong commitment of the United States government to improve the delivery of health services by providing digital health solutions that are robust, efficient, and sustainable. Since 2006, the United States government through CDC has contributed over $54 million to digital health in order to conduct near real-time monitoring of clinical programs and epidemic surveillance to achieve and sustain epidemic control. And as Dr. Nyirenda mentioned, we are very close to those numbers and I'm very excited to see the results of those in short order. In the course of 6 months in 2019, the electronic medical record or EMR system was scaled from 206 to 747 ART sites supported by PEPFAR and CDC, which is a significant and astounding achievement. The EMR supports patient-centered care with prompts for appointment reminders, producing lists of clients with missed appointments for tracing, providing clinical care algorithms to ensure the highest quality of services, and assist with risk stratification of clients. Investing in this EMR system, as well as other digital health initiatives, is investing in the health of all Malawians. I'd like to draw your attention to two notable investments today. First, the public and private partnership with TNM to support the creation of a Ministry of Health wide area network that will enable clinics, labs, and health program managers to transmit and access real-time data that allows for timely support for patients and responding to health emergencies like COVID-19. This wide area network will enable 400 sites by the end of September to transmit data, have automatic updates for applications installed at their sites, and monitor uptime and usage at site. It is the pathway for improving referrals for patients, commodity management, virtual meetings, and e-medicine and telemedicine. This is the only beginning of what we can achieve in this realm. Secondly, the National EMR System Help Desk. Investments and solutions at scale can only be sustained if users' needs and issues are identified and resolved promptly. CDC, with the Minister of Health Digital Health team through EGPAF, have created a national help desk that is accessible to users in multiple modes, including phone, SMS, and WhatsApp, and is immediately responded to by a team located within the district to ensure uninterrupted access to the services. Sustaining the help desk requires a committed and diligent team to maintain systems deployed at sites and continued support. Our investments are aligned with the key elements of the digital health strategy, and we will continue to work side by side with the Ministry of Health, including digital health, and CDC's implementing partner, EGPAF, to ensure we achieve the shared vision of providing high-quality services to every Malawian. Joining others in thanking the government of Malawi, the esteemed leadership of the Ministry of Health, and everyone here today, the United States government remains committed to the people of Malawi. Our ongoing support of digital health continue to support the health of all Malawians. Thank you. Zikomo kwambiri.
That was Mr. Jerome making his remarks on digital issues. This time around, let us have digital health remarks from our Secretary for Health, Dr. Charles Mwansambo. Thank you. Thereafter, he is going to ask our guest of honor, Honorable Khumbidze Kandodo Chiponda, for his remarks, for her remarks again. Thank you.
Thank you very much, Director of Ceremonies. Honorable Minister of Health, Honorable Khumbidze Kandodo Chiponda, MP. Let me recognize the Chief of Health Services online, Dr. Queen Dube, Mr. Jeremy Needs, the Charity Affairs, US Embassy, Dr. Lindsay Kim, the Acting US CDC Country Director, Mrs. Vina Sampath Kumar, the EGPAF Elizabeth Glazer Country Director, Mr. Arnold Mbwana from TNM, the TNM CEO, directors and deputy directors from the ministry present here. Let me recognize Mrs. Nyirenda and Dr. Kachali, and the directors of health and social services present online, but here we have Dr. Nafembewe representing the Lilongwe district, the NAC ED online, civil society, members of the press, ladies and gentlemen, good morning. Surely this is an exciting day. Good morning. That's better. In fact, I was told NCDs are preventable, and we've been sitting down for too long. Can you all stand up to let blood flow? And yes, I think that's better. We can now thankfully sit down. I was asked to make some digital remarks, so I'll do just that. Honorable Minister is going to speak on behalf of government, but all I have to say at present is that is to thank the various partners that are helping the country to achieve our objectives in the ministry this time around. Need to thanking the American people for the support through the Centers for Disease Control, and in this case through EGPAF. But we have a few partners that are helping us in the digital field, and I must say that thank you. But on top of that, just to request you to make sure that whatever systems we bring in the country talk to each other. We're at Area 18 Health Center. We saw what's happening there. It's good, and we want to see that the systems for HIV, the systems for malaria, the systems for TB, and all those systems talk to each other, so that at the end, when I'm sitting in my office, I can just go on one platform and be able to link up all these statistics together. With those few remarks, it's now my noble task to request Honorable Minister to address the gathering and launch these various investments that we're getting from USG through CDC and PEPFAR. Thank you very much.
Thank you so much, Dr. Charles Masambo, our Secretary for Health. Let me take this opportunity to recognize our Chief of Health Services. I think she has joined us online, Dr. Khumbidze. The U.S. government Deputy Country Mission Director, Mr. Jeremy Msike, and other U.S. government officials, the PEPFAR Country Coordinator, the CDC Acting Country Director, Dr. Lindsay Kim, the Country Director for EGPAF, Dr. Vina, the Chief Executive Officer for TNM, Mr. Mbwana, and all officials from TNM, the Chief Director and Director of e-Government, the directors and deputy directors from my ministry. There are several with us. Of course, starting with Rose, I've seen Fanny as well. And also the Director of Health and Social Services from Lilongwe DHO, Dr. Alinafe, who is present with us this morning. And also let me recognize the Acting Director from National AIDS Commission. Also our officials from Area 18 Clinic who are with us this morning. All members from the civil society and all our development partners, and the members of the media, distinguished ladies and gentlemen. Is it still morning? Good morning. It's almost noon. That's why I was checking. It gives me great pleasure to preside over the official launch of the digital health investments, which the government of Malawi has been implementing to support health service delivery, and with the support from PEPFAR through the U.S. Centers for Disease Control and Prevention, in short CDC, and its implementing partners. I'm so delighted to join you all for an event of this significance. And indeed, as a minister, what I've seen today, it has really, really excited me in this day and era of the COVID-19 pandemic. It's rarely that I get good news, or that you get, encouraged, that, you are proud of your ministry. But what I've seen today, and especially the mere fact that it is happening at Area 18 Health Center. Because what I've seen, if maybe you had taken me to Queens, Kamusento Hospital, or Zomba Referral Hospital, or indeed Mzuzu Referral Hospital, but it is happening at Area 18 Health Center. And the operators, our young ladies and young men there, it motivates me, it just shows that there are really some good things which are happening at the Ministry of Health with, of course, the help of our partners, and for that, I'm so grateful. I would like to congratulate the key implementing departments in my ministry, which includes the Directorate of Planning and Policy Development through the Digital Health Division, and also the Directorate of HIV and AIDS. Rosie, congratulations. You have come from far, but we are so proud of what you are doing. We are able as a country, to stand tall and say we are almost achieving our targets of 95. I know maybe 2 or 3 years from now, we'll be talking of 99. But all this is happening because of your leadership and also your team. You have put in so much work, you are so dedicated and committed to make a difference, and for that, I really congratulate you. Let me also, of course, congratulate the Directorate of Health Technical Support Services, which is being headed now, our Director, Godfrey Kadewere, and the team as well. But also let me congratulate the District Health officers and officers. We have Dr. Alinafe here. She's a young lady, but she is looking after so many health centers in Lilongwe. It's not easy. Our Ministry of Health, it is one of those huge ministries. We have got so many departments in terms of human resource, and of course, the number of patients. I was just thinking, Area 18, I said, okay, what is your catchment area? Catchment area, it's over maybe 200 or 300,000, because Area 18, you have the residents, but you have visitors, like on a daily basis, people from the other regions, they come, within the catchment area of Area 18 Health Center. So maybe on a daily basis, they would say about maybe 500. But you can imagine the traffic which goes there and how to manage all the variables which, we get, all the information to process it. And, they say information is power, but I guess what is acute is how you manage that information. So I'm very happy with the launch today, because, it makes our life a bit easier, and also it makes the life of our health workers much easier. And I've seen it today at Area 18, where, 5 minutes, you are done with a patient. You can imagine, when you visit most of these our health centers, people, they will say a lot. We are not being assisted. You have been on this queue for 1 hour, for 2 hours. It is true. It happens. And I'm not going to stand here and say they're lying, it doesn't happen. No, it happens. It is very true. We get long queues in all our facilities. But what I've seen today, it minimizes the time where our patient stays in a queue. And to me, that is the most important, that whatever interventions which we make in the ministry with the help of our partners, at the end of the day, it has to be good for the Malawian, an ordinary Malawian. It has to have a positive impact on the service delivery. And indeed, we can only get a good feedback if our patient appreciates that today, this time around, when you go to facilities belonging to Ministry of Health, I'm telling you, the service is very quick. We are being helped quickly. You don't stay long on the queue. You go to the lab, it's fast, they just scan. 2 minutes, you have your result. You go to the pharmacy, 2 minutes, you are out of the facility. That is what we're driving at. So I'm happy that I think we're on the right track with what I have seen today. I would also like to congratulate and highlight the role that US government through PEPFAR and CDC have played in supporting the successful implementation and use of the various digital health interventions. The US government has partnered the Malawi government in the provision of financial and technical support in digital health dating back more than 15 years. I'm so delighted as well to learn that the US government has helped the Ministry of Health with implementation of the following digital health solutions. I'll just mention a few. Rose has done a good job as well on presenting the various solutions which are available. The first one is the electronic health record system, which is supporting HIV and OPD services at the point of care, and the retrospective recording of services in 750 health facilities across Malawi. My wish, my prayer, and indeed I think our plan is that these services or these solutions, they have to be available in each and every health facility in the country, in each and every district. Even to the most hard to reach facilities, they should have the services. And of course, we have to expand it. It should not only be HIV or OPD, but if you can have it across all the programs, I think it would be much, much easier for us. And of course, it's going to improve the way we do service delivery. The other solution is the high-speed connectivity in 400 health facilities to support data transmission and real-time services in health facilities across Malawi. And the other one is the implementation of National Health Desk platform to support the reporting and tracking and response to technical issues and the experiences as well by the end users of all digital health investments. The other one, of course, is the advanced data analytics built over the patient-level central data repository, and also known as the data lake, which promotes evidence-based decision-making. Distinguished ladies and gentlemen, one of the strategic goals of my ministry, as highlighted in the health sector strategic plan, is the universal health coverage. And digital health is key in improving access to health services by common Malawians. To promote the integration of ICT in health service delivery at a global level, the World Health Organization is working with countries to implement the global strategy on digital health, whose purpose is to promote healthy lives and well-being for everyone, everywhere, at all ages. However, to deliver the same, to deliver its potential national or regional digital health initiatives must be guided by a robust strategy that integrates financial, organizational, human, and technological resources. My ministry, therefore, is implementing a national digital health strategy that articulates our vision to modernize health service delivery through ICT. As you are all aware, using digital health solutions is the vision of this government. You may recall that in his State of the Nation address in Parliament, our President, Dr. Lazarus Makathe Chakwera, also selected digital health as one of the key priorities of his government. But also, we invest in digital health. It means we're also, promoting the vision of our president, but also the vision of Malawi, according to Malawi vision of 2063. And the NABRA number 3 specifically says enhanced public sector performance. And as a ministry, especially Minister of Health, we invest in digital health. It means we are going to enhance our performance as a public sector. In my visit to Area 18, which I've already talked about, I was able to see the progress that is the ministry is making to fulfill the same. And I'm happy that indeed we have seen that it is working and it is improving the efficiency of the health center. I was also able to see and experience the patient EMRS system that clinicians are using to support recipient of HIV care. I was also able to see the infrastructure that is being invested to enable these systems function. This includes power backups, connectivity, and indeed end user computers. The help desk demonstration allowed me to see how teams on the site can call and have issues responded to. And I'm so happy that indeed the process, it is very, very tight, which is good for the system. You know, I wish politicians would have a way of escalating our issues if we would have the same number, 2479. But just for politicians, just for MPs maybe, so that you can escalate from the constituency, from the ward, from the TA, you escalate to ward, constituency. Yeah, and finally, yes. But I'm so happy, you know, that it is very, very tight and it provides, you know, feedback. And I'm very happy as well that, you know, the kind of feedback, you know, we even had the record of a patient who has defaulted coming back for a refill of the ART. Even the days, that patient should have come 26 days ago. We have that in the data. And it means our clinicians, they can even follow up. We can use our HSAs as a moyatwaja to follow up on the patient, you know, which is very, very good to give feedback, but it also helps us as a ministry to come up with strategies to encourage our people to come for refills, but also just to come for checkups. And at this time, let me also, you know, appreciate and, you know, register our sincere gratitude to Telecom Networks of Malawi, TNM. And indeed, today they have lived up to their slogan, always with you. Always with you. TNM, pompo pompo. You know, you give them the problem, or they have, you know, quick solutions. But this is what we require from our private sector, from our partners. And I would urge other service providers as well to emulate what TNM is doing, and, you know, complementing the government efforts. You know, government cannot do it alone. We need to work together, the public sector as well as the private sector. So we are very, very grateful to TNM, who had agreed to go into partnership with CDC to facilitate improved and high quality connectivity for these systems. Colleagues, you will agree with me that the digital investments without reliable connectivity will be nothing, and indeed a waste of resources. Let me take this opportunity to encourage TNM to do. They have already done more. The speech was written before they had already done any more. So, but thank you so much for being there for us, and also for you know, going to increase the data which we are going to use. I also increase the space for our, especially the referral hospitals. We'll keep coming on to you to discuss more areas of partnerships apart from digital. I'm sure there are so many areas where we need your assistance. And let me also thank you for the Mudziwatu. This is a very, very good initiative which is targeting ordinary Malawians. And as our president always says that a prosperous Malawi can only be prosperous if we target the people in the rural, and almost 80% of our population, they're in the rural areas. So we are very happy with those institutions who have programs, initiatives, but which are targeting an ordinary Malawian. Ladies and gentlemen, digital health in Malawi promises a number of benefits for the health sector. Of course, improved visibility into health data and health program performance to inform managerial action, but also greater opportunity to improve patient-focused healthcare provision, but also increased space to inform resource allocation and, of course, prioritization with evidence in the face of increasing pressure and also competing needs. It also gives us a great opportunity to integrate patient data and allow informed patient care from any service delivery point, but also improved capacity to plan, deliver, and manage high-quality healthcare service. COVID-19 has been an enabler and the drive to further invest and rapidly use digital health systems to respond to a pandemic. And also let me congratulate my team as well. And now even COVID testing, they have gone digital. You go for testing, you get your results through email or indeed on your phone. So we are keeping up with times. We have a lot of problems, but at least we are trying to keep up with times. This is 21st century. But also, I know they're also working on the vaccine certificate. I think they're going digital as well. You know, once you get your jabs, you have electronic certificate, which is very, very important. Last but not least, His Excellency the President's vision to leverage digital health for the improvement of healthcare in Malawi. And indeed, we are happy that we have our partners who are also supporting this vision. So once again, let me say thank you to US government through PEPFAR, EGPAF, is it EGPAF? Yes, EGPAF as well, but also TNM, but also other partners which I might not even have mentioned here. I know Rose said that in some of the health facilities, especially in the south, we have other partners as well. So please, we register our sincere appreciation. We have come this far because of your support to the investment, especially in digital health. So with these very, very few remarks, let me thank you all who are present here physically, but also let me thank those who have joined us online for making time to be here. This is very, very important to us as a ministry and indeed as a government and also as a country. Lastly, please remember there's still COVID is out there. So let's keep wearing the mask, social distancing, and of course sanitizing, washing our hands. But also let's encourage each other that when the vaccine comes, please, I know all of you here, you have gotten your vaccine, but let's encourage our relatives, let's encourage our grannies back home that it is very, very important that they get the vaccine. The vaccine has proven that indeed it is giving the much needed protection or immunity against the COVID-19. We have already lost a lot of Malawians, and it is our prayer that we should not be losing more productive Malawians. With these few remarks, I thank you all. God bless you.
Our guest of honor this time marks the end of the function. So before we reach the very end, may I have Naomi Sawyer for the closing prayer. Thereafter, our guest of honor, we are going to have interface with the media. They're going to find a place very soon. Thank you.
Let us pray. Heavenly Father, we come before your throne once again this afternoon. Father, we thank you because you've watched over us and you've taken control of this function. And as we are departing from this place, Father, we are asking you for your grace so that everyone else should go back to their destinations safely. We give you glory, we give you honor. In Jesus' mighty name, we've prayed. Amen.
The guest of honor is going to interact with the media. I've been told and instructed that there is some refreshment for us there. Let us use them properly. Thank you.
you.